There is evidence that HRT can cause endometrial, ovarian and breast cancer, but we must sort of stress that that risk is very small for most people. And it does depend on the age when you start taking your HRT, how long you take it for and what type of HRT you take. So, for example, if a lady starts HRT under the age of 51, then when she's taking that HRT, she's only replacing the hormones that most women would still have naturally at that age. So her risk from taking HRT at that point is negligible. It doesn't increase her risk of developing those cancers. The risk kicks in after she has taken it for 5 years over the age of 51. So that's really important, and that's something that I have to go through very regularly with my ladies in clinic. It also depends what type of HRT you take. So when we take HRT, it's often the progesterone bit that's mixed with the estrogen that is the worrying hormone that can cause that risk. So if a woman takes estrogen only HRT, that doesn't increase her risk of breast cancer. Now, it may slightly increase her risk of endometrial cancer if she still has a uterus. So in those ladies, we give them the progesterone as well, and that will then decrease their risk of endometrial cancer. And the risk of ovarian cancer is very, very small with any type of HRT. It is negligible. They say about 1 in 1,000. It also depends on what type of progesterone that we give. So the newer progesterones that we give these days, they are more natural, they're not synthetic, and we have a very safe type of progesterone that we use now. It's a tablet that can be taken at night. It's called micronized progesterone, and utrogestin is the common name for it. And studies so far have not shown that there is an increased risk of breast cancer with that type. So it really depends what form a lady takes, what age she starts it, and for how long for. It's quite difficult, again, with some GPs and some doctors not being as educated as they should be these days. So I see a lot of women that have been told point blank that, you know, you've had cancer before, you can't have any HRT. And it does depend on what type of cancer they've had. It depends if they have had a breast cancer or an endometrial cancer, whether that was one of these hormone receptive positive cancers that, again, it makes a difference. So it's making sure that we know what type it was. But for all those other types of cancers, people that have had leukemia, for example, or cervical cancer, bowel cancer, there is no reason why they can't have HRT. But it may be that you need to speak to your specialist about that or see a menopause specialist rather than just your normal doctor. We must also remember there's other ways to manage the menopause as well. So you don't necessarily have to have hormone replacement therapy. There's other medications that we can use. We can also use topical estrogen for women that are suffering with what we call the genitourinary symptoms of the menopause. So women that have dry vaginas or urinary frequency, recurrent urinary tract infections. So there are other treatments there. So it is really important for these women usually to use HRT. A lot of hysterectomies are often done in women under the normal age of the menopause, and we know it's so important to replace those hormones that they would have naturally have had, as we've already said, to reduce their risk of heart disease, reduce their risk of osteoporosis as well. And actually, if you've had a hysterectomy, you only need to have estrogen only HRT, and so it's a lot safer in a way. You haven't got that greater increased risk of breast cancer. It's negligible, you know, if there is a risk at all.